Welcome to the Psychology Club podcast, brought to you by Vicente Martinez High School.
Hey, my name is Gavin. Welcome to the Psychology Club podcast. We are here with the guest Jesse today. How you doing, Jesse?
I'm great. Happy to be here.
That's good. So, yeah. What is, we just have a couple questions for you for our
Okay.
Psychology Club podcast. Um, Starting off with what is NAMI and what services does NAMI Contra Costa have to offer?
So, the National Alliance on Mental Illness is the largest grassroots mental health nonprofit in the United States. Most major areas have a NAMI chapter. We're NAMI Contra Costa, so we serve all of Contra Costa County in California. So, NAMI Contra Costa in particular, we provide all kinds of services, and all of our services are free to the public. We provide support groups for people of all backgrounds, from adults living with mental illness to young adults or youth living with mental illness, older adults, certain specific mental health issue specific support groups. We also have a writer support group. We have services available in Mandarin, Cantonese, English, and Spanish. We also provide training. So we have our peer-to-peer, which is a 8-week course for those living with mental illness to learn more about the services that are available, to learn more about their own mental health diagnosis and how to get help for themselves. And then there's the crash course, which is for anybody to join, which just helps you understand mental illnesses in general and how to get services for them in Contra Costa County and how to communicate with your loved one about it. There's family to family, which is focused on family members and friends of those living with mental health challenges. And it's how you can get help for your loved one, better understand your loved one, communicate with them about it, and things like that. And we have all of these classes available in Mandarin, Cantonese, Spanish, and English. We also have counseling. So most of NAMI Contra Costa staff are certified Medi-Cal peer counselors, which just means that we're certified with the state as peer counselors and can offer our counseling services. We also have legal services. So we have a lawyer that works with us that if somebody faces any legal issues due to a mental health challenge, we can help with that. I am the program manager for our schools program and our homeless services program. So we provide services to schools like presentations, help with on-campus clubs, and things like that. And then also for the homeless services, we provide everything from help with housing to getting doctor's appointments, signing up for disability, and resources, simple resources such as food and hygiene. There's really countless services that NAMI CC offers.
Hi, my name's Will, and how do you define mental health?
So NAMI CC defines mental health in its own way, and I'll share that with you first. So NAMI CC defines mental health as a mental illness is a condition that affects a person's thinking, feeling, behavior, or mood. So that's how they define a mental illness. How I would personally define mental health is anything related to your thinking, your mood, your emotions, anything related to what goes on in your brain. So how you react to things, how you respond to things, how you process things, how you feel about things, just anything having to do with how you think, feel, things like that.
All right, thank you.
Hi, my name is Evie. My question is, why is it important to have good mental health?
I think, I'll just speak from my personal experience. For me, good mental health has been so important because it allows me to participate in the things in life that bring me satisfaction and happiness. Like being part of my family, being a friend to my friends, and participating in social relationships, being able to participate in school, being able to, once you're ready to work, to be able to have a job every day and maintain your career. And then just being able to get through the day, many mental illnesses like depression, for example, can be debilitating in just getting through the day. And so being able to have daily actions that you take to improve your mental health and maintain your mental health can be so important to just living a healthy life.
And then, How do you get connected to NAMI?
So you get connected to NAMI one with the ending the silence presentation that we did for your school. So we come in and we present and tell you about our services and how to contact us. The best way to get in touch with us is just to call our number, which is 925-942-0767, and get connected with one of our peer counselors who can talk to you about our services and connect you with different resources within NAMI Contra Costa based on what your needs are. You can also email us, or you can go to our website, namicontracosta.org, and see all of our support groups and trainings, and many of them are available on Zoom, and you don't even need to sign up. You can just show up to the Zoom and in-person support groups.
Okay, thank you.
Hi, my name's Alyssa. What strategies do you use to help your own mental health?
Well, for me, one of the most important ones is sleep. Especially me living with schizoaffective, which means I have symptoms of bipolar and schizophrenia. I just do so much better when I get my minimum 7 hours, more like 8 or 8.5 hours of sleep a night. And then also I'm watching what I put into my body. Like it's good, I think, to minimize or do away with like mind altering substances is really important, because those can be hard on your mental health. I think that watching like how much sugar we eat, of course it's okay to enjoy a snack sometimes or a treat, but maybe not excessive sugar because that can affect our mood as well. Caffeine, it's a good one to moderate. And then also social activity. It's so important to stay connected. Humans, we are social animals, and even if you're an introvert who enjoys their alone time, which, by the way, alone time can be important too. I'm sure we're all familiar with the social battery and the need to recharge. So recharging is important, but also having social interaction, even if it's just texting a friend and saying, "Hey, how are you today?" and just having a short check-in, or saying hi to your counselor, or saying good morning to a family member. Just some social interaction, sleep, caffeine, moderating caffeine intake, probably minimizing or getting rid of any substance abuse or alcohol. And all of those are important factors. And there's so many more important factors.
What can you do if you see someone struggling?
That's a great question. So, the first thing you can do is just be ready to listen. Sometimes when I'm struggling, I really just want someone to hear me out. In people who are in 12-step recovery, like from addiction and alcoholism, they say when you say something out loud, it can take the power out of it. And I really think that applies to mental health as well, where sometimes when we're struggling, if we can just tell our friend or our counselor or therapist or family member or teacher, it can really help take the power out of whatever we're ruminating on inside. Also, you can call NAMI Contra Costa, and you can talk to one of our certified peer counselors if you don't feel comfortable talking to someone close to you. You can call 988 if you're in crisis. There's also the suicide prevention hotline if you're ever feeling suicidal. And then there's so many other support groups that are available through like the Rainbow Community Center, which is in Concord, and A3 Miles Hall organization. And if have trouble with addiction and stuff like that, you can go to NA or AA or Dharma. But the most important resources are those ones that we feel comfortable talking to, which is like our friends and family and teachers and counselors. And then also, of course, NAMI CC, like I said, is just, we're always here to talk to you. And, honestly, if you don't want to talk to someone in your area because it's just really private, you're always welcome to call a NAMI chapter that's outside of your area and get help from them as well, if you want a little bit more discretion. So those are some of the ways you can reach out and ask for help.
Thank you.
So what's one thing that changed your life that you'll never forget?
Well, I guess on the topic of mental illness, just when I was diagnosed with schizoaffective, so many of us grow up in like stigma. There's stigma around illnesses, all mental illnesses. And especially when I heard something like a mixture of schizophrenia and bipolar, I thought, what am I going to do? Um, how is my life going to change? And I think that's why my work at National Alliance on Mental Illness Contra Costa has been so important because part of the healing process for me and what changed my life was being able to use my mental illness and my own experience with recovering from mental illness and having daily maintenance for my mental illness is being able to share my techniques with others and to be able to share with students like you and help people understand that they're not alone. And even the symptoms that can be the most overwhelming and seem the most strange or unfamiliar to you, other people, countless other people have been in those shoes and have been through those symptoms. And people like the employees at NAMI CC, which every employee has lived experience with mental health challenges, can talk to you about. And so, yeah, I would say the diagnosis and then also getting into advocacy was a really life-changing experience for me.
Okay, thank you.
What if someone is too nervous to speak to someone to get help?
Um, so I would always, if you're nervous, like I mentioned, if you're nervous to talk to someone you know, I would encourage someone to call, like somewhere like NAMI Contra Costa, like our warm line. And if you don't want to use your full real name, you can even use, I don't always suggest this, but if you really want privacy, you can use a pseudonym. You can use a random name and, um, and ask for help that way. Um, and if you really want privacy. You can also call the suicide prevention hotline 988, and you can just use whatever name you want. And if the provider does tell you that they think you're in crisis and you need a higher level of care, then you can discuss that when the time comes. But I wouldn't let being worried about talking to someone. I would reach out, use services like 988 and NAMI Contra Costa to in those situations in case you don't feel comfortable talking to someone who knows you personally, because we don't share our at NAMI Contra Costa our clients' information with anybody. We don't publish it. It's completely private. It's protected by HIPAA, um, which is a privacy policy. And so I would encourage them to reach out to someone at NAMI Contra Costa or another agency where they don't know anybody, and they can get a little bit more private care.
Why is lime green associated with mental health?
So you know what? I actually had to look this one up. When I saw that, I was like, huh, I should really know the answer to that. But I had to look it up. So what it is color psychology suggests that green promotes balance, harmony, and a sense of renewal. It is believed to have a positive influence on mental health by reducing anxiety, promoting relaxation, and fostering a sense of hope and optimism. That is what I was able to find from a mental health advocacy center, and that sounds pretty good to me.
Thank you.
If somebody thinks they have a mental health disorder or challenge, how can they get diagnosed with it?
That's a fantastic question. So the first step is to contact like member services at your health insurance provider, um, and tell them that you would like an appointment with a psychiatrist. And then through them you can schedule, or of course, if you're under 18, you can talk to your parents and ask your parents, or even if you're over 18, you can sign a waiver so your parents can schedule the appointment for you. But if you're scheduling for yourself, call member services, ask to schedule an appointment with a psychiatrist. And then when you meet with the psychiatrist, that's so private. I mean, they, by so many laws restricting them for sharing your information, you might as well just be completely forthcoming with the psychiatrist. And so and that's how you would schedule a psychiatry appointment to get diagnosed.
Okay, thank you so much.
Hi, my name's Elizabeth. How does stigma around mental health affect people seeking help or wanting to seek help, and how can we help reduce the stigma?
So just what you guys are doing right now, like being part of this podcast, having someone like me on who lives with schizoaffective, and like this podcast is such a great way to do that, making it available on YouTube to other students. Just so and also not saying that you have to share this openly with everybody like I am, but if you have a friend who is struggling and you feel comfortable, then I would say, if you feel comfortable, you can share about your own mental health struggles. Um, also, you can break barriers around it by, if someone you know is struggling with mental health and you think they're being isolated for it because it's more public, like a student, um, you know, be an example. Go up to them and ask how they're doing, or even don't ask how they're doing. Just have a conversation with them, and be there for them, and or just be someone for them to talk to, even if it's just for a minute or two. Just really leading by example, and then being open about our own mental health challenges um, can be such a great way to break stigma. Because many people, like with my own illness, schizoaffective, they just don't understand it, and that's why I think it's so important to be public about it. For me, just that's my own decision, not for everybody, but because I don't think I'm personally, like, when I'm thinking about showing people how breaking stigma around mental illness, I don't think is I'm what people expect when they hear of schizophrenia. And so I try to show people the recovery side of it and the hope for a normal or even above average life, even when you're living with a serious mental health condition.
And how can people become more aware of and avoid using stigmatizing language?
Um, so this is kind of an interesting one because there's the standards, like what I shared in the Ending the Silence presentation, where you would say someone living with a mental health condition instead of someone who suffers from or someone who has. But I think it's really different for everybody. I have an unpopular opinion. In the presentation, we said not to use the term brain disease. Um, I actually liked the term brain disease when my psychiatrist said it to me because it helped me realize that this isn't a weakness of my brain. This isn't something that I did wrong. This is a disease of my brain. Just like someone who has diabetes has to take insulin, I, living with schizoaffective, have to take my medication. And it's an illness that's out of my control. And so I think, of course, saying living with a mental health condition is kind of the proper way to go. But I think it really just matters on the person. Some people are sensitive to different labels. Some people are not. Like I said, me personally, I liked the brain disease one because it helped me understand that it was a medical illness and not something wrong with me. But I think that's really based on the person, and you might be on a person to person basis.
Thank you, Jesse, for joining our podcast today. Like and subscribe, and thank you guys for watching.
Thank you so much for having me. This was such a pleasure and an honor. I'm really grateful for all of your time.
Thank you.
Thank you.
Thank you.
Thank you.